Hello, this is Dr. Jawad. Please subscribe to my channel for more up-to-date videos, and thanks for watching. Hello everyone, this is Dr. Jawad. In this short video I'm going to talk about anemia and the most common form of anemia, and that is iron deficiency anemia. Now, iron deficiency anemia occurs both in males and females. However, it's more common in females. Why? Because females, every 28 days, they have their menstrual cycle. With the menstrual flow, they lose a lot of iron through the blood loss. Also, too, pregnancy. Females who are pregnant, the unborn child takes a lot of iron, and that will deplete the mother of the necessary iron, so they become iron deficiency anemia. Also, too, parasites. Parasites in the GI system block the absorption of iron, which will cause iron deficiency anemia. So what is this? Iron is needed to make hemoglobin. Now, what's hemoglobin? Hemoglobin is our oxygen transporter in the blood to the tissue. Now, it's either going to go throughout the blood, which is going to be in the form of hemoglobin. It's going to go to the muscle tissue in the form of myoglobin. It's going to go up to the brain, and so forth and so on. It's needed for energy production. Also, too, it makes T cells. Now, T cells, that's part of our immune system. And again, if you have an iron deficiency anemia, this is where you're opening yourself up for sickness, illness, and disease, because it's going to affect the immune system because of the T cells. Now, some of the symptoms, if you have iron deficiency anemia, the number one symptom is fatigue. Okay, fatigue because if iron is needed for the oxygen transport in the blood, and you're not getting a sufficient amount of oxygen transport in the blood, then this is where you're going to feel fatigued. Increased heart rate, rapid breathing, especially going upstairs. You're not going to have the endurance as you once had. Restless leg syndrome. Restless leg syndrome, one of the symptoms is a deficiency in iron. ADD, poor memory, hair loss. If you start losing your hair or thinning your hair, it may be due to the cause of that you not have enough iron in your system. Bruising, if you bruise easy. Also, headaches. A lot of my patients who come in with headaches, especially females, I'm always asking, are you deficient in iron? Now, the recommended dosage of iron per day from the RDA is 8 milligrams. 8 milligrams per day on the minimal amount is needed. Now, postmenopausal women, you have to double that. You're looking at 18 milligrams per day for postmenopausal females. And pregnant females, you're looking at over 3 times that at 27 milligrams per day. Because remember, the pregnant female, the baby, the unborn child, takes a lot of iron to live, and this is where it's going to cause an iron deficiency anemia, especially in pregnant females. Now, what are the causes? The main cause, as I'm looking at, is celiac disease. Now, when you have celiac disease, you have malabsorption of a lot of nutrients because you have poor digestive function due to the autoimmune disease. Okay? IBS, if you're looking at a parasite. Parasites, unchecked parasites throughout the GI system causes a malabsorption of iron, which will give you iron deficiency anemia. Also, too, low stomach acid will give you iron deficiency anemia. So with my patients, I make sure that they have enough gastric acid in their system to break down these nutrients for better absorption. Gastric bypass, chronic inflammation. Chronic inflammation is part of the immune response. So again, the iron is needed to make proper immune cells. So again, if your immune system is not working right, this is where you're going to get chronic inflammation. So where do you get it from? Yes, a supplement. I always recommend, of course, a supplement for, if it's needed. However, I always recommend diet. First and foremost, we need to change your diet. And I always recommend the best sources are the animal sources. Okay? Animal sources, definitely grass-fed beef, wild-caught salmon. Those are my first that I always recommend because, again, they're better absorbed. Now, for better absorption, we need vitamin A, copper, and zinc to increase the absorption into our system of iron. So again, if there's a bad diet or malabsorption, or if they have poor bile function through the gallbladder and they're not absorbing the fat-soluble vitamins, you're going to have a decreased absorption. Also, too, with calcium, if they're taking a calcium supplement, taking iron and calcium is actually going to decrease the absorption of iron into the system. So I always recommend take the calcium first, wait about 3 hours, and then take your iron supplement separately. Because also how it affects the thyroid, if you have a decreased iron in your system, iron deficiency anemia, it's going to affect the conversion of inactive T4 to the active T3 hormone in the thyroid. And this is where you're going to get, again, fatigue. You're going to get hair loss, poor memory. Okay? So again, this is just iron deficiency anemia. If you liked the video, please hit the like button down below. Make sure you share it with a friend. Thanks for watching. I'll see you in the next video.